In this video, we present our technique using knee tap for joint aspiration and injection of PRP and BMAC after an ACL reconstruction. Studies show that this biologic augmentation could be useful for the healing process. In the first step, we perform the knee joint aspiration to protect the cartilage and ligament from catabolic effect from red blood cells. In the second step, we perform the PRP injection as a source of growth factors. And finally, in the third step, we perform the bone marrow aspirate concentrate infiltration as a source of growth factors and cells.